Hello, I'm Dr. Robert Lush, a board-certified OBGYN physician with over 30 years of clinical experience. Today we're going to talk about first trimester bleeding. So if you're in your first trimester, 13 weeks or less than 13 weeks, then you may experience some spotting of blood or even more blood or heavy bleeding. And obviously this is quite disconcerting. Turns out that half of all pregnancies approximately have some bleeding in the first trimester. So it doesn't necessarily mean that you're going to have a bad outcome. However, certainly we prefer it when you're on the half that doesn't have that. So on the average, approximately 1 in 12 women have miscarriages, and usually the women who are going to have the miscarriage in the first trimester are on the half that do have the bleeding, but that doesn't mean you will. A little bit of light spotting can happen normally, especially after intercourse, and sometimes a few days after intercourse. So if you have a little light spotting, a few days, 2, 3, 4, even 5, 6 days after intercourse, that can be a normal sign. It doesn't mean ignore it. It just means that that there is a possibility, a good possibility, that it was just a response to that. When you are pregnant, even early on, all of your blood vessels dilate. That makes you more prone to vaginal spotting after intercourse. It makes you more prone to gum bleeds when you brush your teeth, nose bleeds when you blow your nose, or just bleeding with a sneeze. So that's a possibility. It can be an indication of an infection, so we encourage you to make sure that you don't have an infection beforehand, but if you have other signs, itching, burning, discharge, then it's important to get that looked at. Hopefully before you're pregnant so you don't have one, but it might be an indication, so it's worth getting that looked into. Sometimes it can be an indicator of what we call threatened miscarriage. Maybe you're going to have a miscarriage or an ectopic pregnancy, so you need to know what are your risk factors for ectopic pregnancy, and basically those risk factors includes any infection, trauma, or irritation in your abdomen. That's called the peritoneal cavity. So if you've had a sexually transmitted infection in the past, like chlamydia or gonorrhea or pelvic inflammatory disease, or if you had a ruptured appendix, or if you had a C-section or any abdominal surgery, then those are some of the things. Or if you had endometriosis, so those are some of the risk factors, something else that might have damaged your tubes for an ectopic pregnancy. So if you have those risk factors, then it's important to contact your doctor. If you have early on some spotting, your physician will want to know, but it doesn't necessarily mean if you're low risk, you don't have any other problems, that you have to sail off to the emergency room. These always happen on the weekend for some reason. But if you're having significant pain, or you're at higher risk, you have diabetes, you have other health issues, or your bleeding is much heavier, then that warrants going in. So you should not use this to, again, this is general information to make a clinical decision. You certainly need your healthcare team to help you and advise you for your particular circumstance, but knowing that some spotting in the first trimester with up to half of all women can sometimes be reassuring and give you the time to look into it further, to evaluate. I've provided some links that might also help you with some information. Of course, your healthcare team needs to be the ones to ultimately help guide you and get you the decisions to get you the appropriate healthcare. I hope you found this helpful. Please leave your comments. Thank you.